in the gynecology clinic at Bellevue. We do all types of gynecology care, and today we're going to focus on family planning after bariatric surgery. We do see a lot of bariatric patients in our clinic for both gynecology and family planning. I'll focus on the family planning today. So why birth control? After bariatric surgery, we are expecting a rapid weight loss, weight changes, and there can be some vitamin deficiencies. This can affect a pregnancy if it's soon after surgery. So we usually recommend no pregnancy for the first 2 years after your bariatric surgery. That's the recommendation from the bariatric clinic. There's some known association with this period of rapid weight loss and vitamin deficiency with preterm deliveries and low birth weights for the infant. I already went over that recommendation for first 2 years. So use of reliable birth control can help prevent pregnancy during this time. I like this little graph and poster because it really just shows us in picture form and in gradients the most effective, which is the top row, which shows us that less than 1 in 100 women can get pregnant while using these methods. The middle row is moderately, still very effective, but we'll discuss that in further. And the bottom row is least effective. So things that may not work too well, but can still be used. I'm going to focus on the top row, giving you the most effective methods. I'm going to just quick chat on the one that says sterilization. That's permanent birth control and usually requires surgery. So we'll move on to other methods, such as the IUD and implant. Here are some IUD samples of the IUDs available here and at Bellevue, obviously, starting with the non-hormonal one and the ones with hormones. I'll go over each one of them individually. The copper IUD, which is the non-hormonal one, also known as Paragard, works by inhibiting sperm motility, some movement, prevents fertilization. So it helps you not get pregnant while not having any hormones and having a regular period. Occasionally, we do see some bleeding and cramping at the beginning, usually resolves with more time. And sometimes we do see heavier periods and cramping with periods, which typically were resolved with some ibuprofen, Motrin, and Advil. Benefits of the copper IUD, it's a non-hormonal method. Once again, you can still get your regular periods, especially for women who like their periods. It's a LARC, so long-acting reversible contraceptive, which means that we put it in, it stays in, it works. So no need to remember to use birth control. And once removed, fertility resumes. So once you decide you're done and you'd like to get pregnant, we can just remove the device and you can go ahead and try. The hormonal IUD looks a little different, same shape, pretty much same size. But this one releases hormones right into the uterus. The benefits, again, you don't need to remember to use the birth control. And for patients who already start off with some irregular periods, it does protect your lining, so it does protect you from GYN cancers or abnormalities that can happen. Common side effect with the hormonal one is it can cause no period during the use, and that's due to the medicine, so it's safe, or it can cause some irregular bleeding and spotting. Both IUDs, as I mentioned, are long-acting reversible options. They do need to be placed by a provider, so you have to come into the clinic or go to the gynecologist. And it can be used longer than the 2 years that's recommended. The non-hormonal IUD can be used for 12. The hormonal IUD, depending on which one we use, 5 to 7 years. Next method is the implant in the arm. I'm sure most of you guys have heard of this one. This is a nice picture showing you the location of where it's inserted, and the actual size of the rod. It's a plastic rod, and it's inserted in the clinic with some anesthesia. And why doesn't everyone get the implant if it's so easy? It's typically the main reason of irregular, unpredictable spotting. So the irregular bleeding that can occur. Medication is similar to that IUD, so it can also stop your period based on the medication. And some people have a fear of a foreign body on them. It does need to be inserted by a trained professional and removed by someone who is trained as well. Moving on to the middle row, here we have 6 to 9 patients that will get pregnant while use in 100. So much, it's very reliable, but has its downfalls, and a couple of reasons why. I'm going to focus on the one I circled, which is the injection, the shot. It's called Depo-Provera injection. It is a hormonal contraceptive. It's effective up to 12 weeks, which means that you have to come into the clinic every 3 months to get it. Main side effect is it can stop your periods and or make you bleed irregularly. It can also cause some weight gain. So because of that, it's not very popular with our bariatric patients, and we don't always recommend it as well. The fact that you have to come in every 3 months to get an injection also decreases the effectiveness, because sometimes we forget. The next options are the combined contraceptives, which include the pills, the patch, and the ring. One major side downfall on it, I guess, would be to remember to use as directed. So now it needs your participation. With pills, daily pill use is important. So that already decreases the effectiveness if we forget. The patch needs to be changed once a week for 3 weeks, and the ring needs to be removed every 3 weeks. It can provide the most regular cycles, so it does help you if you like to see a period. It makes you feel more comfortable. This is probably one of those methods. It needs to be prescribed by a provider. Okay, and caution with bariatric patients is at the start of use, what is the weight? What is the BMI? That may decrease the effectiveness of, let's say, a patch use and the absorption. And oral absorptions based on the type of bariatric surgery. I believe they've gotten a little better, but in the past, sometimes oral absorption can change, which means even though you remember to take the pill every day, may not be as effective as we would think it is. And of course, ring use, which means that you have to be comfortable inserting it. It's a vaginal insertion. Last row of options are obviously the least effective. It includes condoms, even though we always recommend condoms. It protects you against infections. Condoms don't always get used. So if not used, not working. So that decreases the effectiveness of a condom. Fertility awareness and pulling out, not the most reliable methods. If you're comfortable with those, you just have to recognize that one, your cycles may change, or if your cycles are not regular, it's going to be very hard to do rhythm method or any of those other fertility awareness that you may be relying on, because we won't know exactly when your cycles are. Common questions that I get from patients when we're discussing birth control is, what is the best birth control method? And I will tell you that the entire graph I showed you, the poster I showed you, they're all very good methods of birth control. It really depends on the patient, on how reliable they are to using the method, how comfortable they are, and how comfortable you are with the potential side effects. Second question, will birth control cause infertility? It really doesn't. Birth control provides fertility protection while using it. So once you stop, your fertility can resume. So it's not going to cause you not to be able to get pregnant in the future. And of course, I did add something to my presentation today, was male contraceptive. So we do often focus on our patients. We're talking to female patients, but sometimes after talking to patients, they tell me, well, my husband has a vasectomy. Well, guess what? That's very reliable contraceptive if that's the person you're with. So if that's in your relationship, the method you guys are using, then that's enough not to get pregnant. And of course, condoms, which will protect against sexually transmitted diseases. Okay, let me just bring my presentation down. And
Great. Can people see okay? My slides are coming up?
yes.
Great. So hello, everybody. My name is Colleen Denny. I'm a physician at Bellevue, where I've been for the last 5 years. I am an obstetrician gynecologist, which means that all of my work is really specialized around fertility-related questions, reproductive health care, taking care of pregnant people, delivering babies, helping people decide when and with whom they have their kids. I'd like to talk to you a little bit today about COVID vaccines and fertility. So just to sort of get a sense of what the big issues are in this conversation, COVID-19, as all New Yorkers know, is still a big deal. It's unfortunately still killing hundreds of people every day, which is very frustrating so far to this pandemic that we've been going on for the past year and a half. We now have COVID vaccines, and we know that COVID vaccines provide protection against getting infected with COVID in the first place, or if you do get infected, having a really bad case of COVID. So generally, vaccines work by teaching our bodies to recognize and fight off a disease without us having to catch the full-blown infection. And by the time that we're adults, we've usually had dozens of vaccines by this point in our lives. We've had vaccines against chickenpox or measles, mumps, hepatitis, the flu vaccine. Those are all sort of the same idea of medicines that help us to prevent us from getting very sick from infections that are pretty common among human beings. So when COVID vaccines started coming out late last year, people were excited by having something to prevent people from getting a full-blown COVID infection. But also with any new medicine and treatment, we as health professionals had questions, and our patients did too. And one of the most important questions, there are obviously a lot of things that people wanted to know about the new vaccine, was whether the COVID vaccine affects our ability to have kids. And that's really important for patients who want to have kids, but it's especially important for people like me and Nurse Mera who take care of patients who want to have kids. So we'd asked ourselves and we asked our colleagues, is there anything we should know about this vaccine when we're giving it to patients who want to be fertile? That is, they want the option in the future of carrying a pregnancy and having a healthy pregnancy. And to answer that question, there's kind of two parts. The first part for human fertility is you have to be able to get pregnant. And then the second part is you have to be able to carry a pregnancy to term in a healthy way. So it's sort of a two parts of the question of whether the COVID vaccine affects fertility. And so I'm going to talk about the second question first. And that question is just sort of best phrased as, does the COVID vaccine cause pregnancy complications? And the easy answer is no. The vaccine does not cause pregnancy complications. And that's true either if you got it before your pregnancy or even during your pregnancy. The first studies of the vaccine, all the way back at the end of last year, they showed that it worked and was safe, but they weren't actually researching it in pregnant patients yet. They started by looking at people who weren't pregnant. So we didn't have the answer to this question last winter. Now, 9 months later, we do have information from using this vaccine in pregnant patients, and we can show that it is safe. And it's useful to really name all the things that it is safe from. The vaccine does not cause birth defects, it doesn't cause miscarriages, it doesn't cause premature births, and those are some of the most important things that we care about as doctors, as nurse practitioners in reproductive health, as midwives. We were really relieved to see that information. And we found that vaccines are so safe in pregnancy that actually at the end of last month, the national group of OBGYNs said we should recommend it strongly. It is safe and it is important for our pregnant patients. And the reason why it's especially important is that for people who are pregnant and aren't vaccinated, getting COVID is much worse, unfortunately. Pregnant people who get COVID, the true infection, they are more at risk of going to the ICU, they're more at risk of needing a ventilator, and unfortunately, they're more likely to die compared to people who aren't pregnant who are the same age and healthiness. And unfortunately, in New York City and generally throughout the United States, COVID cases are on the rise. And especially if you're pregnant, it's really hard to predict what COVID is going to be like for the whole duration of your pregnancy. That's 9 months from now. So then that first question I mentioned about fertility is what I want to talk about next. And that is, does the COVID vaccine, getting it, make it harder to get pregnant in the first place? And so to answer that question, we really had to think about how does someone get pregnant? It's a complicated process. It requires working eggs, working sperm. You need your fallopian tubes, and you also need a uterus that is healthy. But we also know that system, while the reproductive system has many moving parts, but the COVID vaccines don't affect that system. They're not affecting those organs, and they don't affect those cells like eggs and sperm. And how do we know? One is just from the very beginning, we made the vaccine. We know how it works. And like I said, it works the way other vaccines do. It teaches the immune system. It doesn't work through the reproductive system, which is the system that helps people get pregnant. The other fact is now that people have been getting the vaccine for a year, we've seen thousands of people who have gotten pregnant after they or their partners have had the vaccine. And again, because of this, these national groups of OBGYNs and midwives recommend that if someone is trying to get pregnant, they should have a vaccine. It'll protect them and take care of them if they're able to successfully conceive. So you may have heard from friends, from family, from social media, why have I heard that the COVID vaccine can make people infertile if you're telling me all these people are having pregnancies and being perfectly fertile after they got vaccinated? It's sort of hard to trace where this rumor came from. If you look through the internet, it's sort of the trail runs cold, and it's obviously a really scary rumor to hear. There are kind of two guesses about where this rumor came from in the first place. One is that people are confusing it with injectable forms of birth control. As Fanny was mentioning, there are shots that people can get that help them avoid pregnancy when they don't want to be pregnant. But that's not a vaccine. That's just another medicine you get through a shot. The other thought is about how people got this idea that it might make people infertile. There was some very early research on the vaccine that the vaccine might have some interaction with a protein in our placentas as human beings. And those of you who have had babies, a placenta is the organ that supplies nutrition to your baby when you're pregnant. But like many other early worries about COVID, it turns out that that just doesn't affect health. Placentas are not actually affected by vaccines. But even when it's not true, even knowing these facts, it's really hard to stop a rumor about something that sounds scary, especially when it's about healthcare and about something that's so important to people as fertility and building their families can be. But I would say, as someone who is invested in helping my patients have healthy pregnancies, be pregnant when they want to be pregnant, there are a couple key takeaway points. The most important thing is that COVID vaccines are very safe at baseline, and they make it much more likely that all people, including people who want to be pregnant, less likely that they'll get sick or that they'll die from COVID. COVID vaccines do not make it less likely that people are able to get pregnant when they want to be. And COVID vaccines don't cause problems for pregnant patients during their pregnancy. And in fact, the other side of the coin is that pregnant patients who do get true COVID infections, they get much sicker than people who aren't pregnant. So there is something at stake here. And I think the most important thing I would take away is that if you or someone you love wants to have a healthy baby in the future, the most important thing you can do for your health is avoid getting COVID while you're pregnant. And getting vaccinated is now one of our best tools to do that. Hopefully you've all heard this or seen the signage, but if you're a Bellevue patient, all Bellevue patients and really all other New Yorkers can get walk-in free COVID vaccines in our lobby in the main Bellevue hospital. You don't need to have insurance, and you don't need to have any proof of citizenship if that's something that you or your loved ones are worried about. So like Fanny, I'll open this up for any questions. I would love to hear them.